On this episode of the Ask Mike Reinold Show, we talk about some advice for studying for the physical therapy boards. We talk about integrating strength training into our rehabilitation, and we talk about some prehab concepts with ACL injuries. The Ask Mike Reinold Show. Helping people feel better, move better, and perform better. Welcome back, everybody, to the latest episode of the Ask Mike Reinold Show. I am here at Champion PT and Performance in Boston, Massachusetts. I'm here with Dan Pope, Dave Tilley, our student squad, our squad of students. We have Mike the Skid Man, Skid from Northeastern University, and Keisha, what the heck is her nickname? We nailed it. Her nickname is What The.
Yeah, what the? That's weird.
Keisha, what the heck is her nickname? From Regis University.
Takasha.
Where's Regis again?
Colorado.
In
Colorado. How did I not think of that?
I knew that.
Takasha.
Keisha, what the heck?
Takasha's a
Because
gymnast.
her name's Heck.
Keisha, we'll call her.
Keisha, what the heck is her nickname? I love it. That's awesome. Do you guys want to do questions or just talk about
it's just banter.
Keisha's? No? Good.
Either one.
All right, let's get right into it.
More?
Let's get right into it. Skid, you want to do this one?
Do the first question.
Ooh, you're going to alternate?
Tricia from Woodstock, New York. How would you go about starting to study for the board exam? Should I take a practice test and see what I am weak in and focus on those chapters in the book? I am having a hard time starting.
Love it.
Great question.
Usually a hard time starting.
Yeah, that's true.
That's, yeah.
Opening the monster book.
Yeah, well, I mean, it's daunting. You got a lot to do, so I don't know. Like, heck, you guys are a lot closer than I have. What did you guys do?
I was it Score Builders? Is that the one? I think I used Score Builders. My school had the program where we came in and we actually took a bunch of practice questions, and then it just led us to where our weaknesses are. And I personally read through the entire book, and I ended up really focusing on the areas where I scored poorly. And then I took some more practice exams. I figured out where I was still limited, and I focused on those things, and I just kept on fine-tuning. I think what was good for me is I actually had time off to study for this. I know a lot of PT students are not able to do that. My recommendation is obviously you have to do what you have to do, but if you're able to take some time off and be able to fully engage and study, I just felt pretty confident going to the exam because I had the opportunity to prepare for it. So that was big for me.
Yeah, I did similar fashion. I took an exam, a practice exam, went through and saw what I didn't do so well on, and then I, after that, read the book. So I went through the book, and things I felt really comfortable on, I kind of overviewed. Things that I did not feel comfortable on, I outlined and note took, or got with a couple people in a group and chatted it out, or tried to come up with case studies and stuff. And then I did another practice test, went through the book again. Worked pretty well.
I like the group idea.
Yeah, that was
that's
good.
A good idea.
It's only so long that I could stare at my book at 6 hours a day at my desk, so
Yeah.
I had to go out and do stuff at coffee shops.
What'd you guys do as a group? How'd you do it?
We would find the things that were the most problematic for all of us. So if three of us really struggled with integ, we would go there and quiz each other on skin stuff or whatever, different bandages, and then maybe come up with come up with case studies that they had in the back of the book and talk them out loud about what we would do.
Nice. Okay.
Tag.
So
studied
I wouldn't use that for the factory call. Don't use that as your main analytic absorption, but do it as because a lot of the stuff on the exam is kind of case studied. It's not always what's this. You have to kind of think a little bit.
Yeah, I'm a little out of touch. I did it before the interwebs. We were checking our email with our 288K modem, super lightning fast for text. The text would appear like this. Remember, a picture. You got a picture in an email, and I was like, this is gonna be funny. This is gonna be a funny joke. It's hilarious.
Carrier pigeon son.
I remember for me, we had that study guide, but we also had practice tests, and I would say I got a ton out of the practice test, and I think I actually saw some questions almost word for word the same on there. But the practice test, these guys have a more valued opinion on what to do. I think they nailed it. I would do that. For me, I would just say that everybody feels this way. It's not just you. Everybody feels that there's a lot to learn, and everybody does probably better than they think.
Yeah.
I think on my practice exam, I was scoring 40s.
Yeah. Don't freak out about that.
Yeah. I mean, I think everybody freaks out, but I thought the test was appropriate. I didn't think it was odd or anything. When are you guys taking your boards?
Mine are in July.
When's that? How many months from now is that? So.
5?
It's good math. I like that.
Use the fingers.
All right, so we have 5 months. What about you, Kate? April. All right. How many months is that?
75 days.
75
Wow.
days.
Smart
So you guys,
countdown.
obviously you guys, I see you guys cramming in like during their clinicals here when there's some downtime or they're here a little early or late. They're studying. I see that. You guys have any other tips? Anything you're finding super effective that you're doing right now?
I think everything that they said, and then just looking at the timeline and planning it out, so it's not this huge,
I like that.
daunting task,
Yeah.
but you have 10 pages to get through this day, and then 20 the next day.
Yeah.
So it's a lot.
That's good. That's great advice.
That's my number one is consistency over intensity.
That's
for sure.
that's a personal productivity thing too. I mean, that's my, on your calendar, you just schedule from whatever 6 a.m. to 10 a.m. every day, and you just say like skin, or whatever, like musculoskeletal, neuro, and you just, that's all you're doing for the day. And if you have a great day and you nail it, you don't have to do it again or whatever. Like if you're struggling with neuro, then you schedule more days. But Skid, what about you?
I would say going along with having a plan is to have daily and weekly goals, something that you can work towards, and then hopefully achieve that goal, and then kind of move on and set more goals for future study.
Oh yeah, break it up. I like it. Plan it. Good. Awesome. What do we got? Keisha, you got this one?
I got it.
Look at the teamwork, by the way. That was all them.
Scarlett from Las Vegas says, "Love this show. I am a third-year PT student trying to incorporate more strength training into my treatments than just the traditional TheraBand exercises. I was wondering how you gauge your patient's strength training when having to work around pain, surgeries, etc. I know that you should watch form and it should be pain-free, but I want to make sure I'm not missing anything else."
All right, what do you guys think? So how do you incorporate, why don't we just paraphrase it, how do you incorporate strength training into your rehab process?
Well, my thing is specificity, right? So let's use like a field athlete after an ACL surgery. I want to get them back to running, jumping, changing directions, all that stuff. So as far as strength training goes, I'm usually going to do some sort of squat or deadlift, and then a step up or lunge, and probably a single-legged deadlift or single-legged squat. So I'm trying to progress back to all those things, but you probably need to have progressions for those. So you need to have some regressions that are very easy, and then you can just work your way up slowly over time. As far as the pain thing goes, I think sometimes working with some pain is okay, not from a fitness perspective, but I think you're going to be dealing with that for a lot of individuals, and it's going to be very specific to the person that's in front of you. If you have an ACL person that had like a patellar graft, you got to be careful with some of the split squat stuff where they might be a little bit better with a single-legged deadlift, but a hamstring might be the opposite. So you have to think about the individual that's in front of you. But in general, I have a global vision of what I want these athletes to accomplish, and a slow progression, and then it's going to be tinkered based on the individual. So.
Yeah, well put. I would agree. I would say that everything Dan said is totally right. And then something that you've kind of taught me is like, when do they need to be ready? And like you reverse engineer from there. So like say, like you said with Dan, like start of the season is 9 months away. Right, okay, by 9 months I need like super high level, metabolic is totally there. Then it's okay, like 6 months, what do we want to be doing? And then you, from starting the first exercises, like what exercises do you go with? Take the template and say, okay, what are 3 regressions starting from in here on maybe the table when they're kind of in the 3-4 month phase to out there, like how can I make a TRX assisted single leg squat to a higher depth, and then I work my way down and take my hands up TRX. Like have 3 or 4 levels that you can work them back up to, and then it just becomes a little bit of loading principles.
Yeah, makes sense. Yeah, I would say we're guilty of making advanced basic exercises. Right. So you'll see this a lot in rehab. But to use your TheraBand example, and we're fans of TheraBand. But TheraBand makes great products. But to your basics of saying like the basic TheraBand exercises, I think the goal of rehab or advanced rehab or sport-specific rehab, it isn't to just make advanced basic exercises, right? It's basic exercises or basic exercises. And I think what we're doing is we're making really advanced basic exercises right now, and that's weird to me when we got to go from basic exercises to advanced basic exercises, but to strength training. And that's where you really need to, I think that's where the strength and conditioning background comes in and strength training stuff. So yeah, awesome. Skid, what do we got? Last question.
Mike from Farmington, New York. Guys, my 17-year-old daughter tore her ACL last week. She is athletic and plans to continue to be very athletic in college next year. I've heard differing opinions on having surgery versus no surgery. I anticipate we will opt for surgery, but what have you seen in your experience? Is there any detriment to holding off on surgery, assuming she is prehabbing and is stable? Is the patellar graft the best surgical method? Thanks and love the show.
All right, so 17-year-old female athlete. So we'll say she's skeletally mature-ish or whatever, growth plate-wise is good. So we're not talking about an adolescent here. We'll say we're talking about that. So the first question is, does she need surgery?
Right.
My Lord, yes. Yeah. I mean, she is. Yeah, you are. That's a definitive need. Is that you need surgery? What the heck? That was weeks ago. So what were we talking about? I mean, you definitely need. I mean, for her to return to athletics, you definitely need it. So a lot of times, what happens is some people, they look really good after their injury, and you get this false hope, but they're not going to be stable. Then she's going to have a pivot episode when she goes back to sports, and she can just shred that meniscus off or something like that. I mean, she's going to need a stable knee if she's going to be an athlete. Now, I know people that are ACL deficient, and they're fine, right? But I just can't imagine you intentionally do that, especially if you're an athlete. So that's one, you definitely need to do it. What about timing? What do you guys think about timing of the surgery?
I think there's some good research reports about, like, you don't want to go right away because there's a lot of joint effusion. It's pretty cranky. You know, you're probably full of swelling. So maybe talking to your surgeon and saying, like, we want to go 2 weeks of PT, prehab to get you used to the exercises, get your swelling down, get you a little bit more, a better operative candidate. And then, a couple weeks out, I think the research is supported well. But like you said, you definitely need it.
Yeah, normalize the knee, right?
Yeah.
Get the swelling down, get some motion going, go into the surgery looking pretty good.
I think establishing a place you're going to PT and a relationship with the person, because like day 1 to week 1, you're really like a lot of pain. You're probably very, medicine induced, and you kind of need someone who is reliable and has kind of a connection with you. I think that's the biggest thing.
Yeah, I think that's really big too. If you do go down the route of surgery, which you probably should, I think it's probably good to find a good facility with good physical therapists, because the standard of care for ACLs is all over the board, right? You might have a place that has no room to do any type of strength conditioning, no change of direction drills, no jumping whatsoever, and that's pretty common. So you want to make sure that you have a good facility with good therapists that understand the rehab, and they've done it before, and they're confident.
Yeah, well said. And then the last part of that was on graft. Would you do patellar tendon? I would still do patellar tendon. I don't know. I mean, to me, I want that bony fixation, especially in a female with loose collagen tissue. For me, I still think that's my gold standard. I think the literature. I mean, again, you could show that hamstrings are good too, but I just think in my clinical experience, I still prefer how people feel after a patellar tendon graft personally.
Maybe a caveat of what kind of sport they play, if they're a jumping and landing athlete versus a sprinter, something.
Yeah.
Patellar, but
we talk a lot about hamstrings in females. If you take the hamstring of a female, does that really disrupt their quad hamstring ratio and how that impacts ACL as well? And I think that's a valid concern. So I would definitely keep tabs on that here. I guess I'd go patellar tendon. So.
Sure.
Nice, good. Is that it?
That's it. That's
awesome.
great.
Well, thank you so much, guys. We appreciate it. Another great episode. Again, go to MikeReinold.com, click on the podcast link, and ask us some questions. Go to iTunes, subscribe, rate, and review this, and we'll see you guys on the next episode. Thanks so much.